Government health officials are fighting back the Department of Justice following the advice of the CDC yesterday by appealing a federal judge's ruling to lift the travel mask mandate. Here to discuss more about what this means, Columbia University healthcare policy professor, private equity investor, Meghan Fitzgerald. Meghan, it's good to see you. This is such a sort of complicated situation here in terms of the messaging from the federal government. And you actually emailed me regarding this whole situation. What do you think the credibility is here of the Centers for Disease Control and the administration after this whole back and forth?
Yeah, I think it took a real hit. So I walked through LaGuardia, have to wear a mask, board the plane, the mask can come off, get in an Uber, don't have to wear a mask. Teaching up at Columbia, I wore a mask. So I think this is all over the place. And it's unfortunate. I think the CDC wanted a few more weeks for a few reasons to maybe, unwind the mask mandate themselves. They were looking to see what the recent variant was doing. There was an uptick in cases. Right now, about 90% of all the cases in the United States are of the BA2 lineage. Second, we were waiting to see if there was going to be an approval or emergency use authorization for kids under age 5. So they wanted to see how this variant was tracking. Would there be a vaccine for kids? And we still have about 49% of the population eligible for a booster that has not gotten it. So to have their power usurped by a court in Tampa, I think is very devastating to the CDC. And I actually think it'll be unlikely to be a successful challenge. The High Court has genuinely ruled for states to kind of decide what they want to do. So I do think it's very damaging. This is what the CDC is supposed to do. They're supposed to issue guidance. Fair to say they have not done a good job communicating. They probably could have laid out what their plan was when they would unwind a mask mandate, but they did not do that. And as a result, politics got ahead of them. And I think it'll be very, very hard to bring back some credibility. They certainly have to dig out.
Meghan, is this the type of decision that ultimately prevents the pandemic from ending?
No, I don't think so. I think, right now we have so many people vaccinated. We have a lot of people that were exposed. I've been boosted. I think many people watching the show have, been fully vaccinated and boosted. This recent variant is certainly more transmissible, but doesn't appear to be causing more hospitalization. So I think we're on the back end of the pandemic. I don't think it makes it worse, but the next time there is a public health catastrophe, I think you often look to the CDC for guidance, whether it's tuberculosis or Ebola or bioterrorism. And I think right now that agency has some credibility issues, and it certainly wasn't helped by the politics.
So we have this mask mandate back and forth. Does this re-put more emphasis on the vaccine and booster conversation as well, or how does it sort of inform that?
I think it informs now a level of personal risk. You've had 2 years to kind of think about your own risk. And I often tell people around me, think about where you live and who you live with. Is there an uptick in cases? Do you live with someone that is immunocompromised? Do you live with a young child that has asthma? Are you traveling on the subway? You know what a crowded space feels like. So on a subway, I put my mask on. Also, when I'm traveling, I didn't want to get on a flight only to test positive and then not be able to go to a meeting or a conference or take a trip. So I think we're at a level now where you have to decide what your own risk is and have that discussion with your physician and with your family. You're somewhat on your own, but the good news is there's still a lot of information and you've had 2 years to process what is best for you. I'd also say if you are going to wear a mask, make sure you wear an N95. Don't wear a bandana. Don't wear a mask below your nose. Don't even bother then. Wear a mask that fits and wear an N95. There's plenty of places to get it.
And Meghan, earlier this week, we got earnings results from J&J, and they saw really a sharp slowdown sequentially in the uptake or just the sales of their vaccine. Is there a reason why folks aren't taking that one?
Yeah, I think we crushed that vaccine early with some initial news that maybe there was a higher incidence of clotting and side effects. And then as it's gone the test of time, the efficacy has really held up. And I've been very, very disappointed that we didn't do more to help that vaccine help vaccinate the world. We still have countries that have not had one shot among their population, which is just so surprising that we could be talking about 4 shots. And there's places in the world where there isn't even one one shot. And the Johnson & Johnson certainly had a logistic supply chain and cold chain advantage. It was able to get to remote locations, not requiring special handling. So it's really disappointed, but I think J&J has basically somewhat put up a white flag that their forecast had been cut, and maybe that was not really the vaccine of choice for places. So it's too bad. I think we'll look back and realize maybe it was a missed opportunity. At this point, we're trying to get to vaccinations, not vaccines. Going the last mile in many of these countries really requires healthcare providers, someone to talk to people about hesitancy and really last mile logistics to get from vaccines to vaccinations.
Always great to get some time with you. Meghan Fitzgerald, author of Ascending Davos and healthcare policy professor at Columbia University. We'll talk to you soon.